Welcome. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. It is my honor and pleasure to be with you today as Practice Management Nuggets webinar. If you don't know me very well, I'd like to tell you a little bit about me to kind of put the webinar into context for you. I am a certified health information management professional, and I've worked across Canada as a director of health records in many hospitals across Canada. For the last 20 years, my independent private practice has been focused on helping private primary care practitioners to start, grow, and maintain their practice. I am the founder and the host of Practice Management Nugget webinars. And this is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. So let's get to the content of our webinar today. The 5 things that you must do today to protect your professional reputation. If you are a healthcare provider, professional, or practice manager who wants the steps to protect your professional reputation without fear of online technology and social media, then you are at the right webinar today to learn how to take your own digital identity to the next level. So I'm very excited to welcome my guest, Barbara Phillips, to our Practice Management Nuggets webinar. I met Barbara last year online when I joined her webinar specials celebrating the Nurse Practitioner Week. She shared excellent practical information about managing your online identity, and I'm delighted that Barbara has agreed to share her tips on how to protect your professional reputation with you today. Barbara C Phillips is a nurse practitioner and is the founder of the Nurse Practitioner Business Owner, the NPBO, providing business education, resources, and support for entrepreneurial and employed advanced practice clinicians. She believes all clinicians are a business, and thus even the employed clinician will excel with basic business and marketing education. And her website is npbusiness.org. It is my great pleasure to welcome you to Practice Management Nuggets, Barbara.
Well, thank you so much, Jean.
We only have a few minutes to talk with you today, but I'm really interested in sharing with our audience to have you tell us a little bit about your business and your inspiration to start that business.
Well, okay, I'll keep it really short because it's actually rather a long story. But, just when I started my own practice in 2006, I really didn't know what I was doing. And I started reaching out to people to ask them how to start a business. And I actually got more questions directed back to me, as everybody needed to learn this. And so I started sharing what I was learning. And, about 6-8 months into this, the light bulb went off in my head and I said, oh, this is a business. I've been doing ever since. And basically what we do is we teach nurse practitioners and other advanced practice clinicians how to start a business and then how to run that business. In addition, we work with nurse practitioners, like you said, who are employed because we don't get that kind of education in our university programs to really understand about contracts and negotiations and revenue cycles and all the things that make a clinician valuable to a practice. So that's basically what we're doing.
And I hear that story over and over again. Healthcare providers are really good about providing healthcare, but running a business is often something that's new to them and oftentimes not something that they really love. They love providing healthcare, but the business side, they're happy to have some help.
Exactly. And even when we're employed, we want to spend our time with the patients and we're not really so worried about did we capture everything that we're doing or what it means when somebody hasn't met their deductibles. And I think all of us need to take some responsibility and understand that information. It makes us better patient advocates.
Great point. Thank you. Now, in that journey, technology has changed over time, and we have our social media presence, whether or not we actively want to be on social media or not. So, we both know that managing your online identity is important. What is the importance of protecting and managing your professional digital identity and reputation?
Well, I think the biggest thing that we all need to certainly understand is that we're online, whether we want to be there or not, because our information is put out there by various sources. And if we are not paying attention to it, we can find that all of a sudden our practices are slowing up. We're not getting new patients in. It can, or maybe the job offers aren't coming because a bad reputation or poorly managed reputation can really harm your career.
It certainly can. And that's one of the dangers is that if you're not actively participating, doesn't mean that those things don't happen. It's just that you're not knowing about them.
Right, right. And awareness is probably the most important thing. And the first thing that you ought to be doing is just paying attention to what's being said. I mean, you can have an unhappy patient who just leaves a scathing rating or review on you, and that can hurt you more than you know.
Right. Okay, well, I'm looking forward to hearing more about the 5 steps to do this. But first, Barbara, what is your number one tip for the healthcare providers or practice managers about protecting a professional reputation? If you can't do anything else, what is the most important thing to do?
Well, I think just what I just said was just being aware that you are out there. Get on Google, get on Yahoo, get on Bing, and do a search and find out where, first of all, where are you? And second of all, what are people saying?
Okay, so we need to be aware and take the initiative to get things done. And you've summarized this really well for us, Barbara, in your ebook. So here is the link that you can download your ebook from Barbara's website. And we're going to walk through the 5 tips today. So what is our first step?
Well, our first step is going to be, a bad reputation can ruin your career. Obviously, we've got the unhappy patients. We have new patients trying to look us up. And if you look at some of the research that has been done, even that has shown that patients are now looking people up online before they go to see you. They want to know who they're getting involved with. And if somebody looks you up and they see that somebody has said you're a poor provider, you don't pay attention to them, all you're doing is looking at your computer, you made them wait 3 hours, or maybe you didn't even show up for the appointment, that is going to stop patients from seeing you. And it's also going to hurt you in terms of when you later go for a job or something else. So definitely you need to be aware of what is going on and learning how to manage that.
Okay, so having somebody who's put a remark on the web that a new patient is coming to see you, they want to look at you first. What happens if they can't find you at all?
Well, that's just as bad. Why aren't you there? Everybody is online these days, and so people are looking at that absenteeism as maybe you're just not good enough to even be on the line.
Okay, so we've got both of the things that could happen here is that we have something that's been posted on social media that you haven't addressed, and it's not becoming for you, and then you might have something that isn't there at all. So you're not even present. You're not even in the game.
Right.
Okay. So if we have something that is available on social media and it's negative, it's not in the best light that we would like it to have, we've talked about having worried patients and employers or potential business partners. So if you just leave something hanging out there, that doesn't help you.
No, it doesn't help you at all. And, and that's something that it's actually as bad as if you retaliate to that comment. If you go in and you just leave another scathing comment about how that person was rude, crude, and impolite to you when they were in the office. This is something that not only does your practice need to pay attention to, but believe me when I tell you that your malpractice liability insurance carriers are paying attention to this. Your employers are paying attention to this. Universities may be paying attention to this if you're trying to perhaps get some grant funding or anything like that. Everybody looks at this stuff. And, our moms told us this a long time ago, right? You've got to manage your reputation.
That's true. And you made a really interesting point, Barbara, about other people looking up the information, not just the patients. It might be your insurance carrier, other potential business partners. That's something I hadn't really thought about.
Yeah. And we, because our information, at least here in the US, all of our information gets put online by people who are creating these rating websites, which we'll be talking about. But the information that they get is public because it comes from our NPI registration. And that's public information. So they just put all of this stuff online, and then they encourage our patients to rate that. And this information is easily pulled up when anybody does a search on you.
That's got to be a little distressing. I'm glad we're talking about this.
Yeah.
Okay, so our next point then, Barbara.
It's who are you? And basically, who else is you? And I hadn't really thought about this. You don't have to have a name like John Doe or Jane Smith to know that there's millions of people with your name. When I first went online, I had thought, I think I want to get my name as a domain. And I used to go just by Barbara Phillips. Didn't really use my middle name. But when I did a search on my name because I couldn't get my domain, somebody else already had it, and I did a search, I found there were, first of all, other physicians and nurse practitioners who had my name, as well as people like stockbrokers and physical trainers and moms and all of this. But I also found a lot of mugshots of criminals, bankruptcy, the stuff that you don't really want associated with you. And the thing about that is if I was looking that up, if I was looking for me, well, then what was everybody else finding? And how confusing could it be for everybody else? So, with all of the people, on Facebook alone, there's over 1 billion people, and unless your name is so unique, chances are there is somebody else with your name. And so you really want to take a look at this. You want to identify you want to identify you. You want to be the person who says what is going to be said about you.
That's very interesting. And it's quite a surprise if you do a search for your own name, what you can find out. And it might be that other people have posted things about you. You may have been tagged in other people's photos or social media. And there might be somebody else that has a name that is associated with other things. I know that there is a real estate agent in the States that has the same name that I'm on, and she's really active on social media. So one of those tips to get started with, Barbara, is to actually do a search on your own name.
Absolutely. Absolutely. And you are so right about people tagging you. Somebody could absolutely ruin your reputation by tagging you with some pretty nasty stuff because, sometimes people think it's funny or they're just being downright malicious. And so you do have to be careful.
And it might be wrong.
Yes, absolutely. Absolutely. Just because it's out there doesn't mean it's correct.
So just knowing that it's out there and it might be wrong, it might be inappropriate, and maybe there's nothing you can do to take that back, but knowing it's there allows you the opportunity to manage it and be prepared for it.
Mm-hmm.
Okay.
Absolutely.
Excellent. So great second tip. Now we'll move the slides. Rating sites.
Oh, this is so big. There are just a plethora of rating sites that are out there. And as I mentioned earlier, at least here in the States, I'm not sure how you guys handle this in Canada, but in the States, we've got a huge number of rating sites. And what happens is these people go out there and they decide to create this site, and they pull all of our information from the NPI records. So that's the National Provider Information Records, or identifying. And they create these sites, they put a whole bunch of ads on it. And of course, the more people that are looking for your name or any other healthcare provider, these sites go up in ranking. And so they come up more often, and then they make money basically through their advertising. But anytime you're looking for information there, you'll pop up, one of these sites will pop up. They ask you, if you're a patient, have you seen this provider? And will you rate them? And they also ask you, if you're a provider, claim your profile. Some of these sites will charge you, some of them won't charge you, but they're really looking for as much interaction on these sites as they can have. And so I've looked for providers before. I remember I was looking for someone to refer my patient to in a different area, and I wanted to call somebody in that area and talk to them about referring my patient to them. And I pulled up this awful stuff about another provider. And, it just immediately made me take a step back and think, oh my goodness, I don't want to refer my patient there. And then it was like, well, but is it true? Is it not true? So we really have to be aware of what people are saying on these places. And we also need to look at the information. Is it correct? Is it not correct? So you can actually take control of these and do some damage control here.
So the rating sites are a really interesting phenomenon. So what is your opinion about claiming your, when you get a pop-up and it's Yellow Pages ad saying, is this you? Should we be confirming that information? Does that help us?
It potentially can help us. I guess my thought would be and I haven't done this on every site, but some of the sites I did go in, claim it and correct information. I wasn't interested in spending a lot of money on these places at all. And in many cases, you can just do this for free and even put a photo up. And it's just so important to make sure that people know who you are and who your face is. And yeah, I would do this. I would also look at, what people have said. Do I need to correct something? Do I need to address something if it's erroneous?
Something that we talk a lot about is both patient engagement and then attracting the right patients to you. Yeah. So if you're claiming your profile on these rating sites that pop up, maybe there's an opportunity to say, Jean specializes in or has special interest in, so I can get the right patients that I really want to be able to see as part of my practice, coming and attracting to me, because they can self-select and identify themselves and say, that's exactly who I want to see.
Yeah, absolutely. Okay. Absolutely. Yeah.
So there might be some additional benefits there as well.
Yes. I think anytime that you can take charge of what is out there on you, that what is being said, what is being shown to potential patients, the better.
Okay. While we are going to continue on to our fourth step here for Barbara, I just want to ask folks on the chat room to answer the question, have you claimed your rating profiles? Have you used any of those rating sites, and what are your comments about them? So while we let people do that, Barbara, I'm going to ask you to give us step 4.
Okay, step 4, social media. So many people have thought that social media was a fad and it was just going to go away. And I think now we should all realize it's not going anywhere. In fact, it's just going to get bigger and bigger and bigger. And like I had mentioned earlier with some of the research, well, the Pew Commission has looked at how adults are using social media for healthcare, the kinds of things that they're looking for, and they're looking for you on healthcare. The number of people that are using their devices, mostly your smartphones, your mobile devices, to look up information about you, as well as look at information about their healthcare, is just growing in leaps and bounds. So I think it's important that we get out there and claim our profiles on social media. Even if you're not going to spend a lot of time, you want to go out there, first of all, and get your name. See if you can grab your name on these profiles, because I think it's pretty important. I mean, I couldn't really get my name on some of them because I started doing that probably a little bit late, but I would do that now. The minute I see that there's a new site, I would go out and just grab my name, even if I wasn't going to be using it soon or even a lot. But that way, your name is protected. I think, yeah, go ahead.
When I listened to your webinar last fall, this is a point that you made, and I did a head thunk moment. I said, holy smokes, I don't have my name in the domain. So I claimed it, and it's now linked to my website, and at some point in the future, I will do things a little bit better and make a boilerplate with it. But it is now my name. I have a website, so if people are looking for me by name, they'll be able to find it. And it really didn't cost as much as I thought it was going to, and it was really very simple to do.
Right, right. And yeah, that's my fifth tip. But you can also get your name on Facebook, Google Plus, Twitter, Pinterest, YouTube, Instagram, Snapchat, which quite frankly I've never been on, so I'm missing out there. But you want to claim your name because people are looking for you in these places. And I think we all get very scared, if you will, about, say, having a Facebook page, because this whole fear that we have about HIPAA and protected health information. But I think it's really important that we realize sharing information is important. We need to have our disclaimers in place that say, no, we don't do this. If patients are trying to share information, I would message them and say, you need to understand this is public. I can't address these issues. Call me at the office.
That's an important point. When I was looking for a provider recently, where I live, I found his profile on, I think it was just a Google search, and it showed me where his office was. Oh no, it was on Facebook. And all they had on the Facebook page was their office and where to find parking, which is really what I wanted to find. So that was good. But he had over 10,000 visitor hits on his Facebook page and hadn't shared any other information with them. And I'm going, holy smokes, if you could buy advertising and get 10,000 hits on it, you would be thrilled. And here's that free opportunity, and they weren't using it.
Yeah, that's pretty sad. That's pretty sad. Our days of not marketing in healthcare are long gone. And if you want a practice to stay viable, you're going to be needing to bring in new patients, because there's always a turnover. You have patients that, they pass away, they move on, they move across the country, they decide to go see somebody else, and you always have to have new people coming into your practice in order to maintain a viable operation.
Absolutely. So it may not, we're not talking about having a conversation with our patients online, but no, we're engaging with them, we're sharing information with them, and we're having a presence.
Right. And it can be as simple as, hey, it's time to go and come in for your cholesterol test, or it's time to go get a mammogram, or, here's the 5 most healthiest fruits that you can be eating, anything like that.
Right. Okay. So then the next one is our 5th step.
Yes, keep calm and own it. And what I mean by that is, as you said a little bit ago, is own your name. So, one of the things that I think is so important, and like I alluded to begin with, when I set out to get barbaraphillips.com, I found it wasn't available. And so at that point, kind of shifted my strategy, and now I include my middle initial in everything. There's still other Barbara C. Phillipses out there, but I at least own my domain, and I have that on almost every single platform now. So we do need to, if somebody Googles you or Yahoo's you, whichever one you're going to use, and they come up with all of these different people, how do they know which one is you? And that's why I certainly recommend. I do recommend that everybody get their domain name if they can, but some people don't want to go that far. They don't want to try to figure out how to do a website. They don't know anything about forwarding domains, any of that kind of stuff. But you can still go to places like about.me and create
Yes.
just a basic profile page. Put your picture up there, put just the basic of information, just like you might have on your hospital website. Fill that out and put it up there, but at least it's you. And that kind of stuff comes up when you're searched for. So I would definitely recommend there. At best, the best case scenario would be create your own website on your own domain. But if you're not going to do that, go to about.me or something similar to create a profile page.
So that profile page about.me can be appropriate for wherever you happen to be in your career. So if you're starting your career and you're working for somebody else, it still makes sense to claim that domain name and use about.me as your big business card or your big resume.
Absolutely. I think it's really crucial that all healthcare providers have a web page that is just about them.
Okay, I agree. And I think that we are entering the age, as you said, that social media is not going away. So we need to embrace it and find a way that makes most sense for ourselves and for our businesses and our practices. And if you're not in the game, you can't control what's happening.
Exactly.
Okay. And we're not done yet.
No. Unfortunately not. I think there's a lot of things that needs to be done. So for instance, you want to know how to monitor what is being said. You don't want to have to sit by the computer every moment to know what's being said. And so you can put in some monitoring systems in place. For instance, just using Google Alerts, for instance, you can go to Google Alerts, google.com/alerts, I believe it is. And, just follow the directions. What kinds of things do you want Google to send you notices on? Well, maybe it's your name or your practice name or something like that. So that's an easy way just to be able to monitor and do it in a way that you're not having to be online all the time. You also want to learn how to protect yourself against hackers. And what happens if your name has been hacked? What happens if your identity, providers have had their identity stolen?
Yes.
So what are you going to do about that? You need to pay attention of what you're including in your profiles, and you never, ever, ever, ever want to include any private information, because remember this, if nothing else, everything online is public. And I don't care if you think you've made it private on Facebook, it isn't. It's, best practices assume everything is public, and assume that your mother is going to see everything that you put online, or assume that a judge is going to see everything that you put online. And I think if we follow that, we're going to keep ourselves safe.
That's a great practice. Put things online that you wouldn't be surprised if your mother saw.
Yes.
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 Okay.
Or a judge.
Or a judge. Okay. Any other additional tools, Barbara?
Well, I think, for all of us, as particularly for healthcare providers, we are so busy. We are so busy. And so we need to learn how to delegate this information. We don't have to do it all ourselves. There are tools out there that will help us share information such as the Buffer app or Hootsuite or Edgar, any of those kinds of things, they really cut down the amount of time that I have to spend going from each site to share information with the people that follow me.
Okay. And if you're a business, it's a business expense to be able to manage your social media profiles. And I know that there are many other businesses out there that will help you with your patient engagement. So you can hire them to provide content to your website, to your Facebook site that will engage patients and make sense for the type of business that you provide, whether you're a nurse practitioner or a dietitian or a wellness coach or a physician or whatever type of service. There is lots of information that you can share with your patients that you want them to have access to. So there are people out there that will actually provide that content for you. Make sure that your contacts and your websites are current without having that a lot of engagement or a lot of time and work and effort from the healthcare provider who's providing day-to-day health services.
Exactly.
Okay. All right. Barbara, we're nearing the end of our conference time here. I want to make sure that people know that they can ask us a question in the chat. And Barbara, I wanted to ask you, is there anything else that I haven't asked you about getting started with managing your professional digital identity that you'd like to share with the audience?
Oh, goodness. We can talk about so many different aspects of it. I'd say that the most important thing is to, if you haven't started paying attention, pay attention. Go out there, see what's being said about you. Start the process of claiming your name on these different social media platforms. Create and claim your identity so that nobody else has it. And please, when you're doing this, you are a professional. Really pay attention to the photos that you're sharing about yourself. Getting a good headshot, I think, is really important. And you don't have to pay, a professional photographer to go and get a decent headshot that looks professional. You can go into, one of the discount stores that might have a photographer or clothing stores that have photographers and just get a quick picture taken. And that's probably going to be better than you sharing your latest picture at a beer party at the beach.
That's true. And one of the a short tip that I can add about that is to have a background that is light. Makes it work a little bit better on some of the social media profiles as well.
Particularly LinkedIn. And that's something that I need to go do. I didn't know that when I had my photos taken.
Yeah, these are things that we learn over time, isn't it?
Yes, it is.
And I think that's another thing to mention as well, is that you're not going to be perfect at this. I don't know anybody who's perfect at this, but if you don't, the most important part is to get started. So I love your point, Barbara, about claiming your name and being involved. So you've given us this ebook that we can download, and it's got some additional tools and tips and resources. And we can also engage with you in other ways. How else can we keep in touch with you, Barbara?
Well, certainly at my blog at npbusiness.org or Facebook is where I probably spend the majority of my social media time, is probably more on Facebook than I do on Twitter or LinkedIn.
Okay. So we can find Barbara on Facebook, and you can join her blog. She's got great information. You do podcasts as well. And many of these topics are appropriate for all types of healthcare practices. Some are more specific for nurse practitioners, but there's always a great deal of information that we can glean from you, Barbara. Thank you for that.
Well, thank you so much for having me here today.
Okay. You're right. We can talk about this a lot, but we've run out of our time. There are lots of ways that you can join Barbara and ask her additional questions if you've run out of time today or you're following us on the replay. You can go to our website and you can go to our Facebook page, and the links are provided for you there. So our website is npbusiness.org, and the Facebook page, Barbara, is Nurse Practitioner Business?
Yes, it's facebook.com/Nurse Practitioner Business.
Okay, thank you. Barbara, thank you very much today. I appreciate having you here today, and